Where am I? Where's my wife? What's going on?
Hi, Mr. Waldo. My name's Yvette. I'm going to be your primary nurse today.
Who are you?
Mr. Waldo, I advise that you don't get out of your bed because you've just suffered a serious head injury.
Nope, I gotta be somewhere else. I need to see my wife. This is not working out for me. I gotta go.
Okay, Mr. Waldo, I'm going to need you to stay in your bed.
Nope, that's not gonna work. Gotta get out of here. It's unacceptable.
We're looking for Dr. Hamilton. We have a patient who has an aggressive nature.
Place is ridiculous. Can't believe.
Okay, Mr. Waldo, we're going to keep you restrained for the time being so that you don't put yourself at further risk of injury along with our own protection.
Can you please tell me?
She's right. Your provider stated that you might be suffering some confusion and mood swings because of your concussion during
Mood swings?
Yes.
Mood swings!
Ralph has been here for a week, and it's the same thing every day. He wakes up dazed and confused, then eventually calms down by the end of the day, only to wake up the next morning and repeat the same thing all over again. We're waiting for a full diagnosis from the doctors, but aside from complaint of a headache, they don't even know what's happening. Honestly, Ralph is a nice guy, but he's starting to piss me off. Don't tell him I said that, though. Mr. Waldo, Jenna, and Alex will be helping me with your assessment today, and they're both very qualified to do so.
Like she said, my name's Alex and I'm going to be doing your assessment today. Can we start out with giving me your name and date of birth?
My name is Ralph Waldo. I was born December 8th, 1978.
Perfect. Okay. So can you tell me where you are right now and why you are here?
I don't know because you won't tell me.
Okay, so you were in a motor vehicle accident about a week ago and you complained of a headache to your nurse yesterday. Is that still an issue for you?
Yeah, I still have a headache.
Is it super bad? Like, when did your headache start?
Well, it started the second I woke up.
Okay.
I feel like I've had it for a while.
For some time? Okay. So is there any other reason why you might have a headache? Is it from work or another activity that you were doing?
I work from home.
Okay. So is there anything that makes your headache worse?
You talking?
All right. Where do you feel the pain of your headache?
It's right in the front, like between my eyes, just pounding.
Okay. Does it move or radiate anywhere else in your body, or is it just in that generalized area?
Now that you mention it, I feel it in my neck.
In your upper neck? Okay.
Yeah.
So I was told that there was whiplash upon impact. How would you rate your pain on a scale of 1 to 10? 1 being very little pain, 10 being the most pain you've ever experienced.
Well, probably 8 when you're yapping at me, but
Okay.
other than that, 5 to 7-ish.
Okay. So I understand that you're in a great deal of pain. Would you say your pain is within an acceptable range?
No.
No. Okay. Have you been experiencing any weaknesses?
No.
Okay. What about seizures or tremors?
No, should I?
No, but it's always a possibility we have to acknowledge. Are you currently taking any medications?
No, not that I can think of, but God, can you give me something for the pain?
We gave him a Norco a little longer than 3 hours ago. He's gonna have to wait.
Okay. Sorry, you're gonna have to wait for that. Any allergies I should know about?
No.
Okay. So we're almost done, Mr. Waldo. Do you have any pain, numbness, or tingling feeling anywhere?
Yes, my head hurts.
Okay. So just a few more questions, I promise. I know your head hurts. How would you rate your exercise and activity levels?
Oh, fantastic. I was just about to run a 5K.
Wow, okay. Have you had any difficulty speaking or swallowing?
No.
Okay. So, any shortness of breath?
No.
Okay. Do you smoke at all?
Cigarettes? No.
Okay. And then how about your interpersonal relationships?
Great. My wife loves me. My friends love me. I'm like so popular.
Awesome.
I have a great life, or had until you took me as your prisoner.
Okay. Thank you for your patience, Mr. Waldo. Ralph has been in the hospital for about a week now, and every day it's been like this every time he wakes up. His mood becomes more and more bitter. I feel like he doesn't like me in particular, but it seems like he's going to forget about me anyway. Apparently his wife has been coming in at the end of every day, but she stays less and less time each visit. I hope he recovers fully because I feel bad for the poor lady. He seemed to answer all my questions pretty quickly, so I think it's something aside from just a concussion.
Hi Ralph, my name is Jenna. I'm going to be taking the rest of your vital signs.
That's Mr. Waldo to you.
Oh, I'm sorry, Mr. Waldo. All right, I'm gonna start with the blood pressure, so I'm gonna have to roll your sleeve up a little bit.
Do I have to?
Well, it's in your right to refuse, but this is for your health and well-being. It's the best option for you.
Get on with it then.
Okay. All right, you're gonna feel a little bit of pressure.
Like I'm not under enough pressure to begin with.
I'm sorry, it'll just take a minute. All right, 142/78.
That good?
Not bad. It is a little high, but that might be because you're in a little bit of pain. And I'm going to put this on your finger. This is going to check your oxygen and your pulse. And then I'm going to do your temperature orally. You want to open your mouth? Okay. All right, 98.6. And I'm just going to feel your pulse right here. All right, we have 16 breaths per minute. Oxygen's 98 and pulse is 79.
Is that good?
Well, Mr. Waldo, you don't have a history of hypertension, so your blood pressure is a bit concerning. Though you did say you're under a lot of pressure, and that's why you probably were experiencing something.
Okay then.
Thank you for your help, Jenna.
No problem, Ralph. Here's your call light if you need anything, okay?
That is Mr. Waldo to you.
Oh, right. Sorry. Okay, this man is very difficult, but I feel like it's getting easier. The other day he repeatedly told me he's going to flex out of his blood pressure cuff, and that he was too muscular for the adult standard cuff. He was even adamant about being called Ralph instead of Mr. Waldo because apparently that's his father's name. And the last time I was trying to watch for his respirations while doing his vital signs, he just held his breath.
Mr. Waldo, I'm going to be doing some objective data assessments, so I'm going to be checking your pupils. Do you mind sitting up for me?
Sure.
I'm just checking to make sure that they're equal and responsive, which they are.
That's right.
How they react to the light. So first I'm going to be checking for a direct reaction to the light from each eye, and I'm seeing for your pupils are dilating pretty slowly. Also, have you ever been diagnosed with an eye condition?
No.
I'm sorry, but I want to do it once more. Now I'm checking for conceptual reaction light, and from the other eye now having light shine into it to see if there is a reaction. Now I'm going to be checking for bilateral strength, and your range of motion, and your muscle tone. So go ahead and push down. Push my hands up. So range of motion and muscle tone in your limbs seem to be more than adequate, and I didn't notice any abnormal curvatures in your posture. And do you have any balance or dizziness at all?
No.
Can I have you stand up for me, please?
Yeah.
And would you mind touching your heels to your shins? And then I'll be here to make sure that you don't fall over.
Yeah.
And before you sit back down really quick, I'd like to observe your gait. So could you take a few steps for me, please? And let me know if you feel any unbalanced. Your gait seems fine as well.
Whew, I think I fell a little bit.
A little bit, yeah. Here, let's go ahead and take a seat. So I'm going to be sharing 4 objects with you, and I'm going to ask you to recall them later. So can you please do that for me?
Yeah.
So it's going to be sand, a dog, television, and a pencil.
I can do that. It's easy.
I'm now going to be testing your coordination, and I want you to follow my finger with your eyes without moving your head.
Okay.
Don't move your head.
I'm not.
Yes, you're definitely moving your head a little bit. So now I'm going to be testing for your eye coordination. So go ahead and put your finger back and forth between your nose and your finger. Good. Now close your eyes and touch your cheeks and temples. Can you feel them?
Yeah.
Are you able to recall the 4 words I asked you to remember earlier?
What words?
A couple of minutes ago I asked you to remember 4 words that were unrelated.
Cheese.
You know what? I think I'm going to call your primary care provider. Jenna will be helping with the rest of your neuro exam.
Hi, Mr. Waldo.
What do you want?
Mr. Waldo, if you're a lot nicer, this will go a little bit smoother.
Okay, Your Majesty.
Alright, so I'm going to ask you a few questions. How is your sense of smell?
Better than my dog's.
Okay. What about your sight? Can you read that sign over there?
Yeah, it says, don't feed the ducks.
Do you usually wear glasses?
I do, but they're at home.
Alright, that makes sense. So we already tested for your ocular motor, trochlear, and abducens, and now we're going to test for your trigeminal nerve. So I'm going to put my hand under your jaw and try to put pressure against it. Okay. And now we're going to test your bilateral grip function. So can you grasp my fingers? Okay, and don't let me pull them away from you.
Okay.
Alright, and now we're going to test for your facial nerves. So can you blow your cheeks out as much as possible and raise your eyebrows?
Could you give me a demonstration?
So you're going to blow your cheeks out and raise your eyebrows.
Yep.
Beautiful.
Jenna, these tests are way too easy.
Well, they shouldn't be too difficult. Now let's try testing your vestibular cochlear.
Okay, but why?
So it's going to test your bone conduction and your air conduction. So it's going to tell me if you have any obstructions.
Okay.
Alright, so tell me when you stop hearing.
I stopped hearing it.
Okay.
I still hear it. I no longer hear it.
Okay. Alright, so this test is also going to test for nerve damage and conduction. So I'm going to put the tuning fork on your head and you're going to tell me which ear you stop hearing it in first, okay?
Okay.
Alright.
Left, definitely left.
The left. Okay. Let me take a look. Mr. Waldo, why is there a dime in your ear?
Saving it for later.
Okay, we're going to have to make some adjustments because of your behavior. But for the next test, I'm going to put my hands on your shoulders and you're going to shrug for me.
Okay.
Okay, good.
My shoulders are a little sore from carrying on this conversation.
Okay, very funny, Mr. Waldo, but I promise we're almost done.
Okay, well, can I at least have my dime back?
Sure.
Saving up for my kids' college.
Great.
What'd you do to my dime? It tastes weird.
First of all, I didn't do anything to your dime, but at least I know your hypoglossal's working. Alright, last one. So, can you let out a silent scream for me?
Okay.
A little bit quieter.
Ah.
Quieter. Okay, good. Seems like all your cranial nerves seem to be in place. Is there anything I can do for you before I leave?
Have you seen my dime?
No. Check your pocket.
Huh.
Alright, Mr. Waldo, your primary care physician anticipates you still will be having some memory issues, so that should be expected for the time being here.
Yeah, the primary care physician's definitely correct.
Well, I appreciate your help, Jenna, and I will finish up the examination here. If you could document your analysis, that would be helpful.
Of course. Bye, Ralph.
Bye.
let's finish up your exam with your sensation and reflexes, and we'll be done.
Okay.
I'm going to put an object in your hand, and I want you to tell me what it is without looking at it.
Okay. Feels like a pen.
With this pen, I'm going to outline a figure on your hand, and you're going to tell me what I draw.
Okay. An infinity sign.
Good. Now let's work on your reflexes. I'm going to strike your quadriceps tendon to a reaction.
Okay. I will mosey on over here. By the way, nice pants.
Good. Now I'm going to test your plantar flexion. Could you take off your shoes?
Yeah.
I'm now going to be testing your plantar flexion. Could you, so I'm going to be grabbing your leg.
Okay.
Perfect. And then just one more test.
Okay.
Awesome. Good. Everything looks pretty well. So the only thing that I would say is that you've been struggling with your memory and some mood issues. But that's something that we can continue monitoring and working towards for improvement. So before you go, is there anything that we can get for you?
Honestly, I'm pretty tired. I think I'm just gonna rest.
Okay. Well, have a good night, Mr. Waldo, and use your call light if you need anything.
Ralph. Mr. Wald is my father's name.